Any declarations of interest? No? Wonderful. So then we're on to minutes of the previous meeting, which are pages 3 to 10 of your agenda item. I will move them. Is there any questions or comments about the accuracy of the minutes? A seconder to accept the minutes then, please. No. Thank you. All happy to accept them? Yeah. We are unanimous in that. Perfect. So then on item 4, which is the service delivery performance report, is pages 11 to 26. The meeting starts on page 12. I think I'm handing over to Andy.
Thank you.
Please. Thank you.
Chair. Okay, so performance report, we'll start with the response elements as we typically do. So lots of the data in here is for the period from the beginning of December to the end of January, so the completed months at the time of writing the report. So to start with, between that period, we attended a total of 1,612 incidents. Basically, that constitutes an increase on incidents when compared to the same period in 21-22 of close to 8%. That same period has seen actually a reduction in fires, but the increase has been driven by a quite significant increase in false alarms over those 2 months. Year to date, we've attended more incidents this year than we have last year, and we've spoken previously about the increase in numbers, particularly in July and August, because of the extreme weather conditions. So last year we attended 10,096 incidents. It looks like we'll be attending approximately 11,500 this year. So we're looking at an increase of around 14% this year on year, in terms of number of incidents attended. Figure 1 under 2.3 shows the trend in fires month by month. The trend in incidents we attend month by month. And you can see actually in the reporting months of December and January, it's been pretty static. It's been pretty similar in terms of what we would normally expect to attend in these months. But again, that chart does show that spike in July and August of incidents attended. So when we move on to figure 2, which basically shows the incident types over a 12-month period, the level of special service calls and false alarms remain largely consistent over the 12-month period. That is the blue and grey lines if you've got a colour copy, which I don't think you have. So it's the lower 2 lines on that chart. Sorry. So traditionally, fires follow a pattern of being relatively low in the autumn and winter, peaking in the spring, and then sort of levelling off in the summer. But the chart does show how this year has differed from that because of those extremes in July and August. And what we're experiencing now is the typical what we do experience. Figure 3 under 2.5 shows the breakdown by district. Now, to date, clearly City of Nottingham has by far the most incidents this year, with Rushcliffe the least. Then we look at a breakdown by incident type. So for this, we're talking about priority type of fire. So just a reminder, a P1 incident are those that pose an immediate threat to human life or pose a risk of severe human injury, where intervention has been necessary and has the potential to save life and reduce any risk to property. P2 incidents pose serious hazard and high risk threat to the environment, society, property or heritage and requires an immediate response. And P3 incidents pose a potential hazard to human life, the environment, society, property or heritage, or incidents which pose a confirmed low hazard to human life. So the vast majority of incidents we attend are P3 incidents. So the breakdown in figure 4 shows the number of each of those types that we attend over the 12-month periods. And as you can see, those more serious P1 and P2 type incidents tend to stay fairly static throughout the year, with slight deviation in the P3, particularly this year in July and August, where we attended so many wildfires, which would fall under that category. So moving on, a key target under our CRMP is that we attend on average first appliance from being mobile to attending the incident within 8 minutes. Now, in the reporting period between December and January, we've had good success in that area, with the attendance times being 7 minutes 52, so below that target, which is really positive. However, again, because of that extremes of demand in the summer, we are currently, across the year, measuring at 8 minutes and 18 seconds, because we had those extremes in the summer, which we spoke about last time. I think it was the last meeting, I believe, around the impact that had on attendance times. The good news is that, as we did predict that the the overall time would start to come down in the autumn and winter, because traditionally we do meet that attendance time a lot better over those months. And it has reduced that 8 minutes 18 that we're now reporting has reduced down from 8 minutes 23 when we spoke last time. So it is heading in the right direction, which is good. The reality is we won't catch up, though, this year to get back below that 8 minutes attendance time. It will be a metric that we exceed this year. We talk each time about on-call availability, and again, there's a positive here that this year, 22-23, so far up until the end of January, we're averaging on-call station availability at 87.1%. Our target is 85%, so we're above target. We're slightly a fraction below the percentage we were achieving last year, 21-22, where we were at 87.37%, but it's still a good achievement this year. Figure 6 breaks down per station, and you can see on there that since April, since the start of this financial year, 9 of the on-call sections are performing above that target of 85%, with the highest availabilities being seen at Hucknall, Miston, Newark and Warsop. The one station that stands out is Southall, which is actually just fall below our minimum standard of 70%. And again, we've discussed previously about the issues that we have around recruitment and retention at that station at Southall. Just to provide a longer view of on-call availability, figure 7 under 2.9 shows that, with the exception of one quarter, since the start of 1920, we have consistently met this 85% availability target, which is good news. The next part goes on to talk about the availability at Ashfield and Retford, which was specific that you asked us to consider each quarter. So when we look at Ashfield, we look at these two in particular because these are day shift crewed stations. So between the hours of 8 in the morning and 7 at night, so the day shift, they are crewed by a whole time and an on-call appliance. And then over the night time, between 7 in the evening and 8 in the morning, they are crewed by 2 on-call appliances. When we look at specifics, we'll start with Ashfield. The year to date up to the end of January, over the 24 hours, one on-call appliance has been available for 85.4% of the time, which is a quite significant improvement on where we were in 21-22 when it was only available for 78.7% of the time. Between 0800 and, so breaking that down now into the two halves of the day in effect. So between 8 in the morning and 7 at night, one on-call appliance has been available for 73.4% of the time. That's the period where we also have a whole-time appliance available. And then between the hours of 7 in the evening and 8 in the morning, we've had at least one on-call appliance being available 93.9% of the time, and 2 of appliances available just 23.3% of the time. Now, both of those figures are again an improvement on where we were last year. Looking at the same metrics for Retford, so over a 24-hour period, one on-call appliance has been available 87.9% of the time, which is exactly the same as what we achieved last year. During that day shift hours, we've had an appliance at Retford available 78% of the time, which is slightly below where we were last year, where we were tracking at 80.4%. Over the evening, between 7 and 8 in the morning, we've had at least one on-call appliance available at Retford 95% of the time, and 2 available 27.4% of the time. Okay. During the last meeting, you asked for us to also consider whole-time appliance availability. So table 1 under 2.13 is a new table that's been brought into this report. This is showing whole-time appliance availability. Now, what this takes into consideration are when whole-time appliances have been unavailable due to things such as mechanical fault, servicing, insufficient crewing levels, the replenishment of contaminated PPE, where they've had to come off the run so they can replace resources, out-of-county training, or where they've come off the run due to crew welfare issues. What it doesn't include is where the appliance has been taken off the run for in-county training or prevention activities, because whilst they're undertaking that activities, whilst we take them off the run in the short term, they are available to be recalled to any significant serious incident. Now you can see from that table, every single station has availability has been at least 98%, which is our service metric that we consider, with some of them being very, very small percentage of time off the run, with Stock Hills, First Appliance, Papa One being off 1.99% of the time. Okay, so we move on to the metrics that we consider for joint control. So the first metric we consider is around 999 calls being answered within 7 seconds. The target for this is 96%. Now, figure 8 shows that performance over the last completed quarters, and that actually performance in quarter 3 is well above this target, and actually the best performance we've had over the last couple of years, where 97% of calls have been answered within that 7 seconds. Similarly, there's really good news in 2.16, which is this around call handling time, where the target is that calls are handled within 89 seconds. So this is where they've gathered all the information and mobilised the appliance. And in that period, December to the end of January, the call handling time has dropped to as low as 83 seconds. So a significant improvement there, and a really good news story. The one area that's not been quite so good over the last couple of months is the availability of the mobilising system. Now, you know that we've had ongoing issues with the mobilising system that are being investigated and worked on. Now, in the 2 months, December, January, the performance of the mobilisation system has slipped, where it's only actually been available for about 83% of the time. So those issues being investigated and continuing to be worked on, and as you know, we are currently in the process of replacing the mobilisation system over the next 18 months. Okay.
Thank you, Andy. Lots there. Any questions or comments on any of that stuff? Nicola?
I've got a few questions.
Okay.
I'll start with the mobilising system. So why has it suddenly dropped so quickly, and what impact is that having on service?
We've had issues this month with certain elements of the mobiliser system around sort of connectivity issues and so on and so forth. The actual impact on the service is minimal in the sense that it doesn't prevent appliances being mobilised. It doesn't prevent the turnouts going out the door, but there are some sort of technical issues with the system that are being looked into.
So it has no impact on the service, or I presume we have a mobilising system for a reason. So
No, absolutely.
if we don't have it, then we must be losing something.
No, we do, but we have backups. We have mechanisms in place across the provided services that enables the system, that enables the mobilisation of the appliances to still happen.
Sure.
I've got several other questions.
Yeah.
So then I was going to ask about 2.13 and particularly Stock Hill, because one of the appliances is off almost 3.5% of the time, and they, particularly the Stock Hill, but also London Road, sort of stick out as and Newark stick out as particularly higher than the others. So what are the reasons behind?
The typical reason will be there is because they are our busiest appliances. So they are the ones that have more contaminated kits because they attend more incidents. They have more mechanical issues with the appliances because they are utilised a lot more. So it tracks there really around the appliances that are our busiest appliances.
So these are the biggest. Even Stock Hill's second one is the busiest. So any reduction, if it was ever suggested that there should be a reduction in appliances at Stock Hill and London Road and Newark, then that would be counterintuitive because they're the busiest.
Not necessarily. They're the busiest because of the area and the demographic they serve.
Yeah.
But if an appliance is unavailable, we've got well-practiced cover arrangements made. So we would move appliances around and resource to risk.
But presumably moving around is a resource in itself.
Yeah, but I would also say our busiest on a normal day, and it's not strictly a specific, there's only about half a dozen appliances actively engaged in incidents at its busiest point, unless you get a day like Savannah Rags or things like that, then that's a completely different game. So there's something like 20 other appliances available to the city and county. Plus our neighbours, of course, who come in mutual assistance.
Yeah, of course. And then my final question was on the very first point, 2.1, which was what has driven the increase in false alarms?
I'm not sure we can really answer that, to be honest.
But false alarms in my section.
Yeah,
Let's come on to it, yeah.
Get picked up from a protection point of view. not sure we can answer it in terms of what's driven that.
Okay, yeah, it's just quite a big
It's a
leap.
big jump.
I'll give you an overview of
You'll
that.
give me an overview, lovely, thank you very much.
Thank you. Andy, just on the mobilising system, and obviously we're moving on to the new one, which is 18 months or so away. Are we on time, on budget to move to this new system? Can you give us some confidence of where we are with it?
I don't know whether you're in a better position than me, Craig, to answer that.
I suppose until we go to market for the tender, budgets are a little bit difficult. We've got some benchmarking we've done with other services that are going out, so we've got a rough idea about what it's likely to cost. There's some dynamics changing between tri-service and joint control about how we wish to work in the future, and there may be some other opportunities to do some work with other fire services as well during that process. So in terms of timescales, we're going into a very sort of cluttered market. So there's lots of people who are swapping their systems at the same time or looking to tender for the same time. So timescales, I think, will be dependent on can the suppliers meet the demand of the services. So there's places like Fire Scotland are looking for a new system, Ireland Fire and Rescue, they're looking for a new system, and the suppliers, there aren't many that provide these systems. So at the moment, we're looking to resource more the project between ourselves and Derbyshire as well. Hopefully, Chair, we'll be bringing back a report to the authority, I would have said in the next quarter or two, to give a full update about it.
I think that'd be useful because obviously, as Nicholas says, it's a metric that most of them we're doing incredibly well on. So you don't want to focus on something that appears not to be working, even though there's resilience behind there.
Yeah.
So that updates even, I guess. Are we looking at a bespoke piece of software that would be designed for us, or are there some off-the-shelf things that can be adapted?
There is a number of services, suppliers that offer a package.
Yeah.
They'll work with you in terms of your own specification. I think we've learnt a lot of lessons on the last procurement exercise about what we would require. So things like we went to things like an attribute-based mobilising system.
Yeah.
So, and it probably made it a bit more technical than it needed to be. So I think we're looking for something that does the nuts and bolts incredibly well, and then seeing has it got any evolution potential to develop after that. So something that actually receives a call, mobilises something very quickly, and relies on very, very well-trained control operators to deal with those calls.
Yeah. I'm keen for us to understand it well, because obviously this was one of the few things flagged by the inspection that kept sort of dragging on a bit, and it's our committee there to reviewing it. So
I made a note, Chair, to come bring an update.
that's wonderful. Did either of you have anything on this first bit? Okay, can we move on to
Certainly.
prevention?
So, yeah,
please?
moving on to prevention then. So 2.18, during December and January we completed just over 2,700 safe and well visits. We've got a target for the financial year 22-23 for 13,000, and at that point we were just over 93% on target for completion, and clearly that's now gone up. 2.19, you'll see a percentage of the safe and wells carried out and the percentage that relates to the over 65 age group and to disabled persons. So we're nearly at half of all safe and wells to the over 65s and 40% to disabled persons. The report and update I'm about to give you now segues really, really nicely into my next report, which will be the fatal fire review. So if you can keep some of this in your mind really as we go through it, it is relevant to the number of fatal fires that we're getting and the demographics of those, so it does relate. Since December 22 and till the end of January 23, the education team have been delivering bespoke education packages to schools in areas where they've had significant fires. What we recognise is the impact that these fatal fires particularly have on the community and the understanding or the nervousness about fire. So the education team have been into the schools that you can see listed in 2.20 to deliver education packages to all years. Part of that is to reassure the children that's in the school, but also to take a message home to the parents. And we're really, really pushing the Safe and Well offer that we've got as a fire and rescue service and asking referrals from those areas to try and reassure the communities that have sadly had one of these fatal fires or a serious fire in those areas. 2.21, we've got a new initiative and we're calling it Risky Schools. And I suppose that could probably read quite wrong, but to us, Risky Schools is schools in particular areas where we've got concerns about the prevalence of fire. So we've had a significant amount of incidents. We're using a data-led approach to look at the incidence of fires in those areas and targeting specific age groups and specific schools when we've got data that could actually improve community safety in those areas. So each of the districts now is going to be given a list of what we're classing as risky schools to target our education
Bryn,
packages and
can we
delivery.
please reimagine that title? Please.
Yeah, okay.
Just,
Will
yeah.
do, Chair. I'll
Thank
take that away, just so that there's
Thank
no
you.
concern with the
Yeah,
schools
it's
concerned.
just, yeah, it's just, yeah.
Safer schools.
Safer schools.
Safer
Great,
schools, yeah,
Well,
absolutely.
that's why you're the chief.
Hopefully a little bit more of a reason than that, Chair. But,
Many more reasons. It's that fast thinking.
Yeah,
Thank you, Bryn.
we will.
Sorry.
We'll rename that so it doesn't give any confusion. 2.22. I'm sure members will be aware that for a number of years now we've had what we call a fire setters programme. These are young people that have had a prevalence of committing arson, have a fascination with fire. They're predominantly referred to us through schools or social services or the probation system if they've unfortunately had a conviction for it. And we work quite closely with these individuals to work through the issues that they've got with fire safety and hopefully stop them at the end. So, and we've had 2 referrals to that scheme through this reference period. So in addition to fire, clearly we've got an interest in road safety. So in terms of road safety, we've delivered road safety interventions to over 450 post-16 pupils. We recognise that post-16 they're just on the cusp of about to start to drive. They're just about to either start driving or have started driving. So we try and do a multi-agency approach, predominantly with the police, but also with the county council and city council road safety teams. The 2 areas that we've covered in this reference period have been Northern Ox College and Retford College. And we've also been working with Nottinghamshire Police on Operation Highway. For those that are not aware, Operation Highway is where the police will pull over a motorist that's committed a minor road traffic offence, and as opposed to prosecuting, what we will then do is go straight in and do some education interventions. It may be seat belts, it may be an unsecured child car seat, it may be tyre depth. All of those things will try in an education programme as opposed to a prosecution from the police, and that works really, really well. 2.24, one of my staff has just been seconded to the National Fire Chiefs Programme. National Fire Chiefs Council is the UK Programme Coordinator for Staywise. Now, Staywise is an interactive computer programme that is rolled out and a bespoke education packages for schools. What the National Fire Chiefs Council found was that of the 45 fire and rescue services in the UK, we were all devising and developing our own education packages, which was a waste of resources. So that's now being coordinated centrally, and we're pleased to say that it's somebody from Nottinghamshire who's got a background in education and as a teacher that is going to be leading that programme. While she's on secondment, she's also going to be working out of Ashfield Fire Station, so we've really, really got a foot in the door to those education packages that are being rolled out and a say in how that's going to be delivered in the future. So we're really, really quite proud of that. In addition to that 2.25, there is another interactive package called Safe Links. Now, you'd be aware of the Safe and Well packages that we offer, and we tailor those to those most at risk in the communities. And you'll be aware, and I talk about it frequently, of the Charlie profile in terms of the people who are most likely to die in fire, over 65, mobility issues, disabilities, etc. We recognise there's a lot of people that may have require fire safety information that don't qualify for one of the Safe and Well visits. So nationally, they're rolling out Safe Links, which is an interactive walk through your own home, looking at the hazards and the dangers in the home. So we're going to be hosting that on our website to give fire safety education to the rest of the community. I'll pause there, Chair, if there's anything on prevention before I move on to protection.
Any questions? Nicola, go for it.
Yeah, I was just going to ask about there's any sort of evaluation of these programmes. I'm particularly thinking about fire starters. Do we track individuals who
We do,
go
absolutely.
through
There's an
and see
evaluation,
if
yeah.
they don't?
So evaluation is one of the key things that they're in prevention. So certainly they'll look at the prevalence of reoffending if that's the case, if they've been convicted, but they will also look at the outcomes from that. So that is fully evaluated. In terms of the education delivery packages, what they will do is a snapshot of the knowledge prior to a fire service intervention. Then they'll do a snapshot after and look at the retention of the knowledge after. So we do the evaluation, see what we can from that.
Yeah, that's right. Go for it.
yeah, thank you. We're also developing for our annual delivery plan too an evaluation approach in terms of enhancing that. That was something HMI observed of us as well about our evaluation capacity. From anything from move to joint headquarters, the evaluation of what it's meant to the service and the authority, Also, we did an evaluation with Nottingham Trent University about Safe and Wells, and there was some learning from that we fed back into the Safe and Well process, and that picked up on our Charlie P profile and those other things. So we've made some improvements around that as well. So hopefully, we'd like to do more evaluation because it's a really good learning exercise, but we certainly do consider that, Councillor. Yeah. The other point I would kind of make as well, Bryn was a bit humble in terms of the services performance around Safe and Well, in all honesty. We had the target for 13,000 for this year. We actually went above that target a couple of weeks ago, and we've achieved that with a couple of 3 weeks to spare. So we think we'll be closer to 14,000 than 13,000. So my thanks really to the whole service, the staff, the leadership, the people that do all the analysis and everything else. So really, really pleased with that, considering the year we had in this last year. You know, that's a super achievement to deal with.
I think you're right, that's great. We ought to minute that achievement. But does that mean we're making the target 15,000?
It is.
It's 15, isn't it?
For 2025.
Yeah, it's 14,000 next year. Yeah.
You're a victim of your own success. Nicola, did you have
I
another
was just going to
point?
specifically ask about the fire starters and if
Fire setters.
fire
Setters.
setters.
There's fire starters being dealt with by fire setters, yeah.
I think it was a prodigy song.
Yeah, it was, yeah.
Prodigy, that's it.
And yeah, just how effective it is and yeah.
Mixed. It's mixed. It depends on the
Yeah.
individuals. Some of these are very, very troubled individuals. If they have stopped the prevalence of fire setting, they can be involved in other activity as well, and it's a signal of, it's a sign of some of the troubles that they've got in their own personal lives. But on a whole, I would say it's certainly over half, probably 3/4 success rate.
And we've got a good relationship with probation and
Yeah,
the police and
yeah, absolutely. That's the conduit for it.
the
Pathways.
what's the word? The stick as well as the carrot.
Yeah,
end of the,
absolutely.
that's the thing. Yeah, thank you.
Bryn, I know I've mentioned it before, but I do think whenever there's the next good opportunity for inviting the committee to one of the school's sessions, I do
Oh,
think,
okay.
I
Yeah.
think it'd be, we might all not be able to make it, but if there's the appropriate school where we can sit at the
Yeah,
back
certainly.
and observe, I think that'd
Yeah,
be really
okay.
interesting for us.
Yeah, I'll invite you to one of those sessions, yeah.
Anything else on this section before protection? No. Please carry
Okay,
on.
so protection, we've got a target of 1,200 fire safety audits, and between April and the 31st of January we completed 894. Of these, 337 required an informal action, which is basically, words of advice, and 29 required formal action. And if you look at figure 12, it shows the number of fire safety audits that have been undertaken over the last 3 years. And again, I'm really proud of the performance and the output from the Fire Protection Department. As you can see, the number of audits over the last 3 years has significantly increased, down to the hard work and dedication of the department. So we're really, really pleased with that. So in addition to the fire safety audits, which are undertaken by my fire safety inspectors, they've also been shadowing our supervisory managers who've been undertaking business safety checks. Now, business safety checks are probably a lower level audit around small businesses where we wouldn't normally go. So Andy's operational crews, they will go out and undertake a business safety check around a small premises. And until those officers have been given their warrant of powers, they're being supervised by my fire safety inspectors to ensure that the quality of the audits is of sufficient nature. And as you can see, the number of fire safety audits is on figure 12. 2.28, we've got a target, quite a stretch target, of completing 500 business safety checks. And between the 1st of April and the 31st of January, we've completed 385. Now, as the year goes on, more and more of those officers that have been shadowed will be given their warranted powers and they'll be able to go solo. So those numbers will increase as they get more experienced, as they get signed off as competent. But in addition to the fire safety audits they undertake and the shadow business safety checks that they undertake, you can also see that they do post-fire inspections, follow-up to complaints from members of the public. They've issued 26 enforcement notices, 8 prohibition notices, a myriad of building consultations for every new building that comes in with the local authority building control, licensing consultations, and they also work quite extensively with Ofsted and the Care Quality Commission in terms of education and care establishments. So they are really, really busy as a department, as you can see, in an ever-increasing workload. Moving on to 2.3, the Community Risk Management Plan sets a target of 3% reduction year on year for unwanted fire signals. And between the 1st of April and the 31st of January, we responded to 3,880 false alarms, which is a 12% increase on the same period. Now, I know, Councillor, you raised an issue about false alarms. So in terms of false alarms, 3 categories. False alarm malicious, where somebody's got a malicious intent, that deliberately phoned the fire service when there is no fire. A good intent, where they've made it in good faith, but it's not an incident where we arrived. And probably more interesting to this committee is false alarm apparatus, which we've talked about in previous meetings, which is where there is a automatic fire alarm system that has activated, mobilised ourselves under certain criteria, and we've gone to inspect that. 2.31, you will see the number of false alarm and malicious incidents relatively low, thankfully, 120. Good intent, where members of the public have had a good intent to call us, just below 1,000, and 2,700 false alarm apparatus incidents. Of those, 591 were of non-residential premises, and 322 of that 591 were at hospitals. The vast majority were at residential premises, and as you can see, nearly 600 have been single occupancy homes or bungalows with telecare systems. And I know we've covered this before, that is where we're seeing a large increase in the number of false alarm apparatus. It's moving more to a care in the community. We're seeing more of these telecare systems installed in private residential or council accommodation or housing association accommodation. And therefore, some of these people are most at risk in society, and we are still attending those, and we are seeing those going up. So thankfully, the non-residential commercial buildings and hospitals are decreasing. The residential premises are increasing, but there is a risk there, and I say it does dovetail into our fatal fire review that I'll cover shortly. Protection work really closely with prevention, because I'm sure members will be aware we've got statutory responsibilities for commercial premises and non-residential premises. We can take enforcement action on those as a protection department. Where these alarms are in residential premises, we've got no statutory powers in terms of people's domestic dwellings. So we've recognised that protection really needs to work closely with prevention, because what we're finding is these are the most at risk and vulnerable in society, and it's important that our colleagues in prevention understand what protection are coming across in terms of the alarms that are activating. So we're really trying to work cross-department in terms of that, so that prevention and protection are closely aligned. 2.33, the CRMP objective has also got a reduction of 3% of unwanted lift rescues. Thankfully, again, small numbers. We've responded to 164 lift rescues, which is a small decrease, 1% decrease from 21-22. And figure 14 shows that decrease, that small decrease. 2.34, again, we've discussed it at length before, the Joint Audit and Inspection Team, which is where Nottinghamshire Fire and Rescue Service work with the City Council, predominantly on high-rise buildings in the city conurbation. In the reference period that we're looking at, we've conducted 20 inspections and 25 re-inspections, which have covered 185 buildings in total. We've still got another 23 buildings to inspect over 18 metres, and another 278 below the 18-metre threshold that require inspecting. Now, the picture with high-rise buildings is changing because the Building Safety Act has now received its royal assent. And the work that is being undertaken by the JATE, a lot of that will come under the Building Safety Act and the new Building Safety Regulator, which will be led by the Health and Safety Executive. So there will be a bit of a transition from a lot of work that JATE is doing to the Building Safety Regulator, the buildings above 18 metres. We envisage that buildings below 18 metres will still come under JATE, and we'll focus on those in the future where the Building Safety Regulator will take over. But that's all coming this year. We anticipate that the multidisciplinary teams that are discussed in 2.36 will take effect from probably October. So that will be council, city council, building inspectors working with fire safety inspectors and the health and safety executive to have that multidisciplinary team approach to the inspection of high-rise buildings. 2.38, as you can see, there's a lot changed, or is changing, in the fire safety and fire protection world. So the Fire Safety England regulations 2022 became law on the 23rd of January. And these regulations place new statutory duties on responsible persons to inform the fire service if any of their fire protection measures are not working at any one point in time. The case being that if that's part of their safety solution, and if for any reason that's not working, then we need to know, because we might want to increase our response to those buildings. So if it's a sprinkler that is part of their passive fire protection systems, it's not working for any period of time for more than 24 hours, then we want to know. So there's reporting of that, as there is the need for them to send detailed plans of their buildings to us. So Andy's operational crews can have a look at those plans when we arrive on site. 2.39, we've been communicating these changes of the new regulations with all responsible persons that are responsible for the fire protection of these buildings. And 2.40, we actively take part in the National Fire Chief Council's protection forums. Now, the National Fire Chief Council have got a position statement that we are supporting and trying to endorse, that all buildings above 18 metres ought to have more than one staircase. I'm sure some of you may remember that the Grenfell unfortunately only had one staircase because the building regulations allow one staircase at this present moment in time. That causes issues for residents if a fire occurs. It causes issues for us because we've got one staircase for all firefighters to use to effect rescue, to effect firefighting, and for the same residents to then try and evacuate. And, you know, I don't need to spell out what the confusion and issues that could cause. So the NFCC's position will be we want two staircases in all buildings above 18 metres. I'll pause there, Chair. If there's any questions on protection.
Thank you. Any questions, comments?
I just think that stuff when it goes above 18 metres and things like that, and that's really, really important given how vast increasing building of
Stock, yeah.
You get a piece of land and you build houses or whatever it is all over the place. And you're talking about cities, the amount of people that are living in flats. You know, you've got places like Nottingham years and years and years ago with being full low-rise developments. You know, the increase in those sort of places now. That's when the towns and cities is huge. And it's a really important piece of work, really.
Great. Bryn, when the changes come in, I think you said probably October, will that be the same people doing it differently, or will that give us some capacity back if it's passed over?
So it's additional capacity. So we have 3-year new burdens funding. So one of the initial JATE officers, we've got 2 officers that are seconded to JATE at the moment in time. We've just been running a professional discussion for one of those to join the new multidisciplinary team, and there is additional funding then to backfill that individual. After that 3-year period, everything's going to be on a recharge basis, so it will create additional capacity for us as well that will be funded. So yes,
That is positive.
I think, Chair, I think I've been relatively clear as your Chief about the world of fire protection is going to place more demands on the fire and rescue service. So business safety checks, for example, we've only got a quarter of our supervisory managers that are currently qualified, and they have to be shadowed. As the other 3 quarters become qualified, that is likely to generate referrals upwards to our fire protection team. Then they have to do more detailed inspections. I absolutely think it's the right thing to do. What we've also done across the response workforce course, we've upskilled them along the way. That's a period of change as well, but that's given far more people a better insight into fire protection knowledge. So it's almost like feeding the beast at the moment, but actually in terms of direction of travel, it's absolutely the right thing to do, but there's going to have to be things around capacity and demand we're going to have to get our heads around a bit.
Yeah. Changing a little, please.
Thank you. Just sort of leading on from that, are all our surrounding forces doing similar things on protection? I guess I'm slightly concerned that we're training people up and that we really want to keep them and not have them poached by other fire services.
we're quite fortunate in the East Midlands. Yes, they are trained to the same level. In the East Midlands, we don't have such an issue of retention. Certainly the South and the South East Fire and Rescue Service in particular have an issue with the retention of fire safety inspectors because they're a very valuable asset, as you can imagine, in the private sector. So retention is an issue. Thankfully, it's not been so much of an issue around here at this present moment in time. But it is of national concern, and the NFCC have been running some recruitment and retention workshops to try and look at the issue of recruiting and retaining fire safety inspectors. So much so that the Home Office has also funded Reed consultants. Reed have gone out and done a national advert, and all the interest from Nottinghamshire has been directed to us to use those candidates. So we are being supported centrally in terms of recruitment and retention, which is an issue in the wider public sector as well.
Yeah, absolutely.
Thank you. Do you have anything? No? Well, thank you both for that. I assume we also have to note the contents of that report. And then we'll move on to item 5, which is the fatal fires review, page 27. It's you again, Brother.
Yeah, thanks, Jay. It's that sombre report. It's that time of year again when, unfortunately, it falls to me to deliver the overview of fatal fires that we've had in the county in the calendar year of 2022, so 1st of January to the 31st of December 2022. You'll be aware that all the details in here are anonymised. Some have been to His Majesty's Coroner, others haven't, so I'm going to give you an overview of the circumstances as opposed to specific locations, details, names, etc. 1.3, you can see in the calendar year 2022 that unfortunately we've had an increase of the number of fatal fires. So unfortunately we had 11 fatal fires from 7 incidents, as you can see, which is the highest it's been for a number of years, sadly. 7 incidents have resulted in the 11 fatalities. So of the 7 fatalities, 1 fatal incident occurred in January, 2 in March, 1 in July, 1 in November and 2 in December 2022. All of the fatalities were within domestic premises. Of the 7 fatal incidents in 2022, I'm sure you're probably aware, 3 of the incidents took place in the Ashfield district. 3 incidents took place within the Nottingham City conurbation and 1 in Broxtowe. Of the 11 fatal fire fatalities within 2022, 5 were adult females, 4 were adult males, and the remainder being female infants. 5 of the 5 fatalities were over 65, and again it's referenced back to the Charlie profile that I talked about earlier. The youngest adult fatality was 28 years, oldest being 91 years, and the infant children were aged 1 and 3 years old. 2.4 gives you the causation. As you can see, tea lights, candles, etc. Is quite prevalent, as are electric blankets. There's 1 deliberate ignition that's still under police investigation. A naked flame, but accidental, not considered deliberate, and another one, there's ongoing inquiries. All of this, again, falls in with a Charlie profile, which, as we've talked about before, has been evaluated in 2021 by Nottingham Trent University. So we're still confident that the Charlie profile that we've got in terms of people most likely to die of fire and the causation is still valid as we look back at 2022. 2.7, so of the 7 fatal incidents, 4 addresses were known to ourselves in the Fire and Rescue Service and 3 addresses were not. So I suppose if we look at the 4 addresses that were known to us, that is indicating that some of the referral pathways are working, we're getting that intelligence back from our partners, and we're likely to be targeting those most at risk. I suppose it's worth mentioning that a safe and well visit won't put a fire out once a fire started. A smoke alarm will give you early warning that your premise is on fire, but once that fire has started, it won't put the fire out. And as you can see from the addresses that we've attended, you know, unfortunately, even though safe and wells have been conducted, they've still resulted in fatal incidents. Address 1, we had 10 fire incidents at that one location since 2017. We did 6 separate safe and well visits between 2017 and the fatal incident occurring. One of which was a faulty smoke alarm replaced by ourselves. Discussions were had with implementing Lifeline and raising concerns over other care needs. Our own occupational therapist also attended the address in June 29 to provide specialist input. I think it's also worth noting that we weren't dealing with this individual in isolation. This was part of a multi-agency approach of all relevant sectors were involved in this, and it still resulted in a fatal, unfortunately. And as you can see from addresses 2, 3 and 4, they were all visited from referrals from our partner agencies. So address 2 from a social worker. This individual had, again, complex medical needs, and a referral was made for the telecare monitored smoke alarm and fall sensors. This goes back to, again, the increase that we're seeing in false alarm apparatus calls from these increase in telecare from those most vulnerable in society. Address 3, again, another referral from social services, concern over smoking in bed. We visited, we did a safe and well visit, and we even provided flame retardant bedding, linen and a throw, but it still resulted in a fatal incident. And finally, address 4, a referral from our colleagues in the East Midlands Ambulance Service, safe and well visit carried out, smoke alarms were present and working, and a sufficient telecare system was in place, and we'd issued flame retardant throws and bedding on that at the request of the family, and still, unfortunately, we've had fatal incidents occurring. whenever we do get a fatal incident, at the earliest opportunity, I chair a serious event review group which will look at all the circumstances. So it will look from the initial time of call, so the actions of fire control, the mobilising crews, operationally what the crews have undertaken, but then also what do we know about the premises, how many times have we been, what do we know about referrals from other agencies, is there an ongoing police investigation. So we try and pull and correlate all that information together, and then I'll make a determination of what we'll do after that, which is generally a community reassurance and engagement event in the days following that to fit smoke alarms and to raise the awareness of those incidents. So as we've been undertaking the CRAE, as you can see from 2.20, we've visited over, well, just close to 2,000 premises, properties in 2022 as a result of CRAE activity. Of these, we've undertaken 458 safe and well visits where we've fitted smoke alarms, 324 of which, and there's been a further 27 safe and well visits have been scheduled after the CRAE activity because it just wasn't convenient at that point. You will be aware at 2.11 that since 2010 we've been employing the services of an occupational therapist. Now at first sight that seems really strange that the Fire and Rescue Service have an occupational therapist, but we're finding that their work is vital, working closely with prevention and fire investigation officers to identify trends and look at other issues that we could implement and other pathways that we could implement to reduce the number of fatal incidents above and beyond the traditional safe and well visit. So we find that that's got some real gravity and we're really finding that beneficial. There's an ongoing challenge to educate partners with the Charlie Profile. So we visit all agencies, we educate them by the Charlie Profile, then as you can imagine in the public sector there's quite a lot of churn and individuals move, leave roles, get promoted and we have to do it all again. So it's a constant theme to educate those in terms of the risks that we've got. Our arson reduction investigation team, so our fire investigation team, they work closely with prevention to look at any learning that we can get from these fatal fires to implement it back into our education strategies so we can learn from these tragic incidents. And in addition to our own prevention department, they work closely with the trading standards across the city and county, looking at electrical safety and white goods, particularly with the electric blankets that are featured in 2 of the fatal incidents, and highlight any trends to our partners in trading standards. And that concludes the fatal review, Chair.
Thank you, Brent. A couple of things. I mean, obviously a number of things have happened in Ashfield, so I've been very closely linked, and I think one of the strong points that's come out is the work that the team have done afterwards. I think they've been very good at communicating with me as one of the local board members, with our district council when it's been council properties or with our partnership now. I think one of the really good things is where you've gone out afterwards already with a programme before we ask about speaking to neighbours, reassuring, because obviously in some of them, I don't know in detail, there were areas where they were all very well-known neighbours, all pensioners and etc. and it frightens that community. So I think the work you've done after that, I mean, I know there's an awful lot of work before, but after that, I think that's been really positive, if you can take some positives from it. So I think
thank you.
that should be recognised that's a good thing. There's 2 things that strike me. I mean, apart from the one smoking one, and I know the chap, I mean, very well. I'm shocked about how a lot more, over the last 15 years, we now have candles instead of smoking, and this electric blanket stuff doesn't seem to go away. And I think a lot of people use it more now because they're nervous about putting the heating on even more. I know what you're saying about trading standards, that it's not necessarily stopping people selling cheaper electric blankets on car boot sales and other things like that. I'm not sure what we can do with these candles. People know it's a naked flame. We're providing things like the flame retardant stuff where people have had that intervention. I don't know if there's anything more creative. It's not like an advertising campaign.
No, it's certainly become more prevalent. It's certainly on trend. Scented candles are more prevalent now than they were 20, 30 years ago. So it is a concern. We do raise it as part of the safe and well inspections that we go. We do give advice to every premise when we undertake the safe and well about the dangers of naked flames, the dangers of candles. You know, it is tricky, you know, but we can only highlight that in terms of the communication. And if people still then want to have a naked flame, if they want to have a candle, then they will.
I mean, I don't want to be a downer on candles. One of the things that really scares me is this stuff you see on TikTok and things where you have tea lights under a terracotta pot to heat your house. These cheap ways of heating your house. And then I've seen them where we've got in at the district council because the pots explode and things. So that's one of the things I'm really worried about, these social media trends where people think, oh, you can heat your house with a candle, and that is not safe. But I don't know why we tackle something that's more viral than we are. Go on.
I think there's a little bit about what we said earlier about the education thing, about not just like the youth education thing, but nationally we're getting a bit more coordinated, I feel, through National Fire Chiefs Council, in liaison with Home Office as well, in terms of some of the funding that's coming through. But you'll also see, if you do watch any TV, National Fire Kills campaign, so, you know, people throw a tea towel on a hob, there's a tea light, there's a candle and things. So I think we are trying to push that. What you do about how people live, I think that is always going to be a difficulty. The reassuring thing, if there are any reassurances from it, we don't feel like we're complacent, although I just made a note around the serious event review, is that, so what then? We're having a serious event review, but so what? Is probably a question we need to ask ourselves internally to make sure we're not complacent. And then really the Charlie P stuff, really, and then what can we do with our local authority partners about the known people and the referral pathways to get there before something actually happens.
Yeah, it's challenging. Are there any other?
Just the known people, the pathways. So if you get a call out, would the officers attending be aware that they were going to one of these addresses?
Depends. So they can put a note on the mobilisation message to the crews depending on what the hazard is. So when the crews undertake the safe and well visit, they may put a note on the mobilising system to alert the incident commander, the crews, that there's a specific hazard. So it depends on the circumstances. So in some cases yes, in other cases no.
And if that person still lives there that we did the safe and well on.
Yeah.
Because if we did the safe
Is it
and well
tagged
last year
on
and
a
did right.
property, not on a person?
So a mobilising system is premise related. Our internal systems are now person related. But as the Chief's just alluded to, is the person in at that time? Have they moved? It's best endeavours a lot of the time.
Yeah.
We did go through a phase of putting every hazard, you know, so we'd put oxygen down if the person was on oxygen, but then never remove them. So again, how relevant was the information at that time? Is the person in? Have they removed oxygen? So it's, in some cases, yes. They're normally time bound now. We normally review them after a set period of time. And somebody has to physically go back and see if that person's still there and if that warning is still relevant.
David?
Yeah, I think it's incredibly tragic in terms of these cases. But I think if you look at all the figures behind it, obviously well visits, all of the sort of kind of targeting that we do to people and all that, and everything that has been done. It is outside the regular day job. But I think if looking at the figures overall and the people that you're targeting, how many times you have to go back to solve them as well, it does prove that we are targeting the right people.
Yeah.
And we're getting the right thing. And that in itself, however tragic that is making a difference to people's lives.
Yeah, and I think we have to recognise the demand on us as well, is that a crew can go and do a safe and well visit, and it used to be on the property, now we're moving to person-centric, so you might do one visit that could be 2 safe and wells, and those 2 people in the house may have very different complex needs. You may have somebody that's got no additional needs maybe altogether, but the other person is quite complex in terms of the house because of care arrangements and everything else. And you may also find that we refer it to the persons at risk team, and it could be weeks and weeks of work on the one property working with partners. So these, you know, what we are seeing is society and people in it are becoming far more complex about their needs. The telecare thing is an issue. It used to be the big buildings. Telecare now, you're talking about single persons in residential accommodation who have got a fire alarm system.
Anything else on this? Thank you, Bryn, for that then. That's the last item. Craig, I didn't know before we conclude if you wanted to update members on Savannah Reg since you mentioned it, or if there's anything other than has been in the press that you're able to say at this stage. So
My understanding is I've not had the update. We had a bit of an update yesterday as senior leadership team, is that the investigation is ongoing with our police colleagues. From a operational perspective, you know, the building is no longer. So you could say, well, what was the success measure then? Is that what I've taken with, because I came back off holiday at the weekend, there's some local residents who are incredibly grateful for the efforts that firefighters and the leadership and management of that incident that didn't lead to them losing their properties as well. We've got some smoke damage, some heat damage to some properties that were neighbouring it, which were very, very close, in a property that has got incredible fire loading. So the good news story is it didn't spread to other properties, and we've had some really good feedback from local residents to that effect as well, which is really heartwarming. And we went well with partners, including Severn Trent, who were able to provide additional capacity in water tankers, because water supply can be sometimes an issue. So we got augmented in terms of, I think, 30,000 litre tankers that were arriving on scene. So the investigation is ongoing with our police colleagues, Chair.
Okay, all right, thank you. Thank you all for your attendance. I'll close the meeting.